Welcome to video 10A. This video will focus on the first measure in the people and community sector, stability and security. Researchers used two indicators for this measure, crime rate and access to community and health services. Stability and security takes into account vulnerable populations that may be at risk for inequalities or experience discrimination, as well as barriers of access to food, culture, mobility, and health services. Crime rates can indicate the well-being of a community, and access to community and health services is integral to the well-being of the people and the community. The first indicator researchers used was crime rate. ECHO researchers created this map indicating the crime rate in the Battle River Watershed using Statistics Canada data from 2019. According to Stats Canada, rural residents experience more crime, including violent crime, than urban residents, while there's not a significant difference in property crime between rural and urban. This second map shows the crime severity index, with the increased values indicating a greater number or seriousness of the crime. It's important to note that there are numerous reports of racial biases in the enforcement of criminal justice. According to the John Howard Society in 2017, Indigenous people made up around 6% of Alberta's population, but were overrepresented at 39% in the jail population. The second indicator for stability and security is access to community and health services. Access to community services is integral to the well-being of a community. Citizens are at a greater risk of poor quality of life if a region lacks necessary services or if they are difficult to access. The first map shows the percentage of the population that have access to a regular family doctor using data from the Canadian Community Health Survey from 2014. There is strong evidence that accessible, effective primary health care is linked with improved community and individual health. However, as you can see on the map, 75 to 80% of residents have a regular family doctor in the BRW, which means that over 20% still do not have access to a family doctor, and even less have access to a specialist. There are also social barriers to healthcare, and vulnerable populations may have a more pronounced lack of access to quality healthcare. The second map shows the median download speed between the years of 2016 and 2020. Access to reliable internet, particularly in rural areas, helps residents to access education, health, and may support social connectivity. So what is being done and what can be done relating to stability and security in the BRW? There are initiatives and incentives in place to improve access to healthcare in rural communities in Alberta, and there are also public safety initiatives to deter crime and reduce victimization. However, root causes of rural crime are complex, and rural communities have seen a reduction in funding for hospitals and social agencies. Better access to community services and support from social and health agencies can help address root causes of crime and also improve the quality of life in a community. Please like and follow for more information about our Health in the Watershed Atlas project.